Director General of Health Ashley Bloomfield back with us. Very good morning to you.
Good morning.
Fair to suggest you've never made a call even close with the numbers you were dealing with yesterday?
Oh, look, every call about an alert level is a big call. You lose a bit of sleep over them. But yesterday, we feel pretty comfortable. It was just confirming the decision that had been made in principle the week before. It would have been nice if those numbers had been a bit lower, but most of them are still contact of cases, and nearly half of them yesterday were actually already in managed isolation and quarantine. So the number of new cases itself was very small. 5
mystery cases yesterday. I'm just looking at the numbers of every lockdown we've ever had, and when we go to move levels, it's at 3, 5, 0, 0, 2, 0, 0, 0, 2, 1. Suddenly yesterday 22 and 5, and we're fine with it.
Yeah, well, first of all, of course, we're 5 weeks into the lockdown, and it's achieved what we set out to achieve. There's no doubt with Delta we would be in the thousands now if we hadn't gone to that alert level 4. I think, just even to look at those 5 yesterday, 3 in one family, we know that where they live is very, very close, same street as another house with cases. So there's a reasonable sort of geographical match up there, and it means we can continue to focus our contact tracing testing efforts on those suburbs where we're just seeing those cases pop up still.
How can you argue that you're still chasing elimination if you couldn't do it in 4 and you're still arguing it's possible in 3?
Well, a couple of things there, Mike. First of all, we've done it from 3 before, and yes, that wasn't Delta, but this time we've got vaccination on our side as well, and we're just about to crack 80% of Aucklanders having had at least one vaccination, so that's incredibly helpful. But I think the second thing is, again, elimination is about not tolerating, zero tolerance of the virus in the community, so it means, yep, it's going to pop up, either from overseas or it might be at this stage still in the community, but we're going to go really hard on it, just as we have, for example, in Northern Hauraki yesterday, a bespoke arrangement there to put in a short lockdown to get rid of the virus out of that community.
But you're going as hard as you want, and you've gone for 5 weeks in the hardest mechanism you can possibly get, and now you're moving to at least 2 weeks of level 3. You haven't eliminated it. Elimination doesn't work, and the numbers don't lie.
Well, we're not back to zero, but in case everyone
that's what elimination is.
Well, elimination is not tolerating the virus, which is what we've done for 20 months. And
in not tolerating the virus, you need to get rid of the virus, and getting rid of the virus, you need some zeros. You haven't got zeros, you're not going to get zeros. Elimination doesn't work.
Well, just to be clear, that is absolutely still our aim, and we're confident.
You can be an aim till you're blue in the face, but it doesn't work. Why don't you just simply admit what everybody can see? It hasn't worked. That's life. Let's move on.
Well, actually, I've got a different view, and I think many New Zealanders have too. We're working, it's working, and that's where we want to go to.
In what way is it working?
Because we've
let me give you the last 2 weeks' numbers. 20, 21, 15, 13, 11, 23, 20, 33, 15, 14, 13, 11, 20, 27, 22. In what way is that working?
Because those are actually, for a Delta outbreak in a big city, Mike, very low numbers. Look across the Tasman. That's how it's working. And remembering that in both Victoria and in New South Wales, they've still got really significant restrictions in place, and they've got numbers in the hundreds or thousands. So, yes, it is working.
Okay, so it's working to the extent that you can suppress it, you can't eliminate it.
Well, it's certainly doing more than suppressing it. We know where all of these cases are coming from within a few days, and that's exactly where we want to be. Where our aim is still to get back to zero. It would be good, and I think all of New Zealand would love it if we got back to zero, and that's what we're still aiming to do. That's why we've gone for a 3.
If after 2 weeks of level 3 it hasn't got back to zero, which it won't, then what are you going to do?
Well, let's cross that bridge when we get to it. But at the moment, we've got a tight level 3. It's got tighter restrictions on movement across the boundary than previous level 3s. So the aim is still to get us back to zero.
At some point, would you concede that you're going, if you still have numbers bubbling away after 2 weeks or 4 weeks of level 3 or whatever it is, you're going to have to concede that elimination doesn't work and we're going to have to change tack a bit? Or vaccination is going to save you?
Well, vaccination is basically the next very important tool in our toolkit, and NZMEs recognise that, as have many New Zealanders. I think the campaign to get over 90% is exactly where we need to be. And just remember, we have always signalled, or at least in the last couple of months signalled, that we're wanting to reconnect the country. We know that means COVID will come into the country, but we're still adamant we want to protect the population, and vaccination is the way to do that.
See, the thing I worry about for you, Ashley, is you sound these days more like a politician than a health professional. You sound like you're doing the government's bidding, in the sense that you've changed your mind on the way it was working because it doesn't work, and now you're spinning their line, which is not actually what your job is it?
Actually, I'm not spinning anything, Mike. My comment about elimination means zero tolerance, and that's what we're doing. I made that in May last year. I'm still doing it. I don't necessarily always have my advice taken by the government. There are aspects of the advice I gave yesterday around the alert level 2 settings that there is more work being done on, which means it wasn't taken at face value.
What did you want to happen?
Oh, it was just gave some advice around different ways of having people in indoor spaces. We've just got more work to do, and it's sort of looking at what Australia's done around a square metre type arrangement. It's just a bit more complex. So
you wanted a square metre type operation. The government didn't accept that advice?
Not at all, no. The advice was 100, a move from 50 to 100. That was the mainstay of it. But then to look at how we could bring in alongside that for larger spaces, arrangements around square meterage.
So you wanted to get more people involved in events up and running, and they didn't take that advice?
No, actually, they did take the advice around more people.
What advice didn't they take?
Well, I'm not going to get into most of it was just small stuff, but what I can say, Mike, is my advice is not always taken, and that's fine. It's like a marriage. You might disagree behind closed doors, but you don't do it out in public.
The school holidays, would you look to move to level 2, given the school holidays are coming up, and after 2 weeks of level 3 in Auckland, the moment you go to level 2, of course, borders are gone and we're all on planes. Is that an issue for you?
Not if we're in a good position. I think we'd all like to be.
No, but with the numbers we've got currently, let's accept for the next 2 weeks the numbers, by and large, are going nowhere apart from where they are roughly, if not up.
Well, let's have a look at that when we get to that. But the key thing is, of course, is what is behind the numbers. And again, as we've seen in the last week or so, most of those cases are known contacts. With Delta, you get a high infection rate, so you get a lot of people in whānau, and some of these have been big families, will get infected, and that keeps the numbers up.
Pfizer says this morning kids under 12, no worries for a jab. What do you say?
Oh, look, I think that's great news to see the first results from that trial come through. I think they said looking for approval in the US by the end of October. We will be watching very closely and absolutely have the aspiration to be able to offer vaccination to our 5 to 11-year-olds as soon as possible.
Latest studies say Moderna long-term are the best vaccine of the lot. Do you regret not buying them?
Not really. I don't think there's too much between Pfizer and Moderna. They're both mRNA ones. We certainly know that they're both better than just about everything else at the moment. So it's great we've gone with a Pfizer-based program.
Appreciate your time as always.